Watch this video to discover the ultimate relief for sciatic pain. I'm going to show you some great techniques for discomfort of the lower back and leg and help symptoms and mobility. The first technique I'm going to use is without any lotion, so make sure you've not got nice, clean, dry and warm hands. I'm going to place one hand, heel of my hand there on the sacrum, the top here, and another one, cross my arms over, and I'm going to place it on the skin. So just watch here, and as I sink into the tissue, I'm aiming just to stretch that tissue. So the client should feel a nice long stretch. Sometimes it feels a little bit burning sensation. But hold that 20, 30 seconds. And we can go diagonally across as well. So then one hand on the glute there, one hand on the lats, and then we're parting across this way. So you get a bit of a diagonal stretch. Okay, and we'll cross hands again and go the other way this way. So let your body weight do the work. I'm not really using my arms for this one. Just sink into the tissue. Second technique I'm going to use, again without lotion, is a form of skin rolling or myofascial technique. So we're going to take a little roll of skin there, and we'll pull it upwards and then keep that up as we move our fingers. So can you see how I'm rolling the tissue? Don't let it go. And we're going to go up. We're just working on the lumbar area. Now with this technique, you can feel where the restrictions are. So we can work across the spinous process here, and you can see it's really stuck on the spinous process. So at this point now, we're going to move the tissue, pull, and just try and release it underneath. Keep that roll going as we work our way up. Some clients, you will struggle with this technique due to different body types, different amounts of adipose tissue, skin stretchiness. Not everyone will do it. Not everyone will like it. On some clients, there will be a burning sensation. But I think it's really useful, and it's really good before you put your lotion on, just to assess the tissue that you're working on. Now we're ready to apply some lotion. So warm it up first. And spread it on the client, on their lumbar area. When you do work on the lumbar region, make sure the towel placement is quite low. So you want to be working on the top of the glutes here and L1 to 5. So with sciatic issues, the sciatic nerve comes from here, comes from this area. Make sure we are working on both sides, but if they do have an issue down one side, you're going to focus on that side a bit more. So this technique is just called crisscross effleurage. I'm parting the tissue. My pressure stroke goes away from the spine. If I bring it towards the spine, then I get the skin wrinkling up here over the spinous processes. So just make sure the pressure stroke goes away, like so. And another form of effleurage or warm-up technique we can use is palmar circles. One hand on top of the hand. We're drawing circles over the top of the glutes, over the lumbar area here, as we work our way up. I'm going to go to a forearm effleurage this time. So from there, use the other hand or elbow on the glutes, and I'm going to effleurage up. But it also feels like a bit of a stretch. With this arm here, if I'm kind of pulling away, and this one I'm pushing up the body, can you see how the tissue stretches? It is also a form of forearm effleurage. Going to move on to a kneading technique or petrissage. So we can use our classic ringing, like so, fingers and thumbs. Really get in there. You can feel these muscles either side of the spine, and with sciatica they might be extra tight here and in a protective mode, or in some cases in spasm, so you can really feel that area. So this is ringing, and then we can move on to a palmar kneading technique. So we can pick up and squeeze down with the heel of our hand. Again, we're going over the top of the glutes, around that iliac crest. Okay, just watch the pressure as we get a bit higher up, because we're then on the bottom ribs. So work in this more fleshy area in the lumbar spine. Going to move on to a cross-fibre friction technique now. So with this one, I like using my fingers. So where the spinous processes are here, the erector spinae is here. I'm going to reinforce my fingers and I'm going to work over the tissue as they come up. So it's kind of pushing that tissue away from the spine. You can see I'm just focusing on one side, on my client's left side for this video. You can do these techniques. You have to come around the couch, keep contact, remember, and work on both sides. While I'm working, I've found particularly tight area here. So what I'm going to do now is have a little feel and use my thumbs. So I reinforce thumbs to start with, sink into that. I'm doing a thumb compression and just to feel and see what my client says that pressure threshold is. So on a 1 to 10 scale, I'm looking for maybe a 7 or 8. So let's have a feel there. What does that feel like?
Pretty much 8, 7 or 8.
7, 8. So I'm on a 7 or 8 here. Now you can see my thumbs have a lot of pressure going through them. I'm going to replace my thumbs with an elbow to make it a lot easier and better for me and my posture. And I'm going to sink back into that tissue, try and get the same pressure. So if that's still a 7 or 8, I'm going to get my client to do 3 slow, deep breaths. Okay, this is nice and slow. You can see, maybe on the video, that the rib cage is rising as well as he breathes. So let him breathe nice and slowly. We keep the same pressure into that area. This is a neuromuscular technique, NMT, and also work on trigger points. After these 3 techniques, we'll get the client to reassess, and hopefully the pressure of being a 7 or 8 will feel like it's gone down maybe to 5 or 6 or even less sometimes. After that, make sure we are soothing over. So I want to carry on doing a bit of deeper work on the left side of the client. So I'm going to keep contact, walk around the couch to this side, and I'm going to do a technique called lengthening. So with lengthening, I would like my client to go into an anterior pelvic tilt. That's it. And then go into a posterior tilt. Now I'm fortunate that my client knows what I'm talking about by using those words. That's it. Relax for me. Most clients won't know, so you will have to demonstrate or tell them to arch their back or stick their bum out, stick their belly out, however you want to describe it. While they're in at that anterior tilt, so the muscles are shortened, I'm going to get my elbow and I'm going to guide my elbow up the erector spinae as my client goes into this posterior tilt. So they're lengthening these lumbar muscles while I'm going in at the same time with the elbow stripping technique. Okay, as I slide back, my client goes into anterior again, and we repeat that maybe 3 or 4 times. Nice and slow. So anterior tilt, and slowly go the other way. That's it. Posterior tilt, which stretches those lumbar muscles. At the same time, my elbow is getting deep into the erector spinae. And come back. And let's slide up. My client's controlling their hips really well. Some clients will try and rush this. We want it nice and slow at the same time. And come back. And one last time. Okay, good. Relax here. After the deep lengthening technique we've just done, make sure you are effleuraging back over. These techniques are really good for sciatic issues and can help with pain in the glutes, lumbar area, or any kind of referred pain down into the legs. But if you are worried about any of the symptoms, then please refer on to a specialist if it is nerve pain. But these techniques are pretty safe to use, and we're just helping with the muscle spasms. So thank you for watching today. Please comment below again if there's any other techniques you want to see, or do you use any different techniques that you would like to share? That would be great. Comment below. And thank you for watching.